Hello and welcome to this American Heart Association goRED Talk, presented by Yale New Haven Health. I'm Dr. Eric Velasquez, the Physician-in-Chief of the Heart and Vascular Center at Yale New Haven Health, and the Robert W. Berliner and Chief of Cardiovascular Medicine at Yale University. Our vision here at Yale New Haven Health is to enhance the lives of the people and communities we serve. It's a part of our mission to create healthier communities. Working with the AHA, we have created a series of talks around health equity and wellness topics aimed at helping you that will help you live a longer and stronger life. We hope that you find these talks informative. Now I would like to introduce today's presenters who will discuss how making small changes to your lifestyle can help you manage your blood pressure. Please welcome Dr. Meghna Rao of the Heart and Vascular Center at Lawrence Memorial Hospital and Dr. Ed Toohey of the Heart and Vascular Center at Bridgeport Hospital.
We're talking about high blood pressure or hypertension today, which is often referred to as the silent killer.
So why don't we start by talking about what blood pressure actually is? And it's quite literally the force of your blood on the inside of your blood vessels as it pumps through. And if this force is elevated, it causes damage to the inside of your blood vessels, which can cause hardening and narrowing of the arteries, which subsequently causes further high blood pressure.
This starts a vicious cycle that not only harms your blood vessels and your heart, but all of your organs. High blood pressure is actually the second leading cause of death from heart disease and stroke, second only to smoking.
So how do you know if your blood pressure is high?
So what we typically do is take the blood pressure at rest. We apply a cuff to the arm while it's resting at the height of your chest, and the top number, or systolic blood pressure, represents the maximal blood pressure in the blood vessels when the heart pumps, and the bottom number is the pressure that the bloodstream falls to, and it's referred to as the diastolic pressure. Both of those numbers are important. A reading of 140/90 or higher is considered to be hypertension, but sometimes we see elevations in the systolic or just in the diastolic. And it's really good for your physician to help you figure out which ones of those to be concerned about.
So high blood pressure actually has very few signs or symptoms often. And it shockingly, about 50% of Americans over the age of 20 have high blood pressure, and many don't even know it. And that prevalence just keeps going up as we get older.
That's true for men and women. And however, the rates of hypertension are significantly higher for women once you get over the age of 65. We see a lot of calcification of the arteries or hardening of the arteries that specifically elevate the systolic blood pressure, which is the top number. So just because the bottom number may be okay in someone, it's still a concern when the systolic number goes very high.
Sure. Let me touch on what you said about the number of women with high blood pressure, which is obviously a cause close to my heart. I think that number is largely attributable to menopause. 75% of women who are postmenopausal are actually hypertensive. And that's a large percentage of the 50 million or so women in the country that have high blood pressure, which is really important because over half the number of deaths from high blood pressure are actually in women alone. Most women are not aware that heart disease is their number one cause of death. So why is blood pressure so deadly?
So having this constantly elevated blood pressure damages your arteries, making them more stiff over time, and eventually can decrease the blood flow and oxygen to the heart, which can cause a heart attack. It also affects the arteries that provide blood to your brain and can cause stroke.
So it only makes sense that we should try to control or mitigate that risk. And actually 80% of cardiac events can actually be prevented with lifestyle changes. We call these modifiable risk factors. And exercise is actually the most important one. We recommend getting 30 minutes of moderate exercise a day, 5 days a week. And so that's 150 minutes a week of moderate exercise or 75 minutes a week of vigorous exercise. And that alone can decrease your blood pressure by 5 to 10 points. And you really don't need to be running a marathon. Any amount of physical activity that gets your heart rate up will count.
That's a great point. It's important to be active, and there's other ways to manage the blood pressure. avoiding smoking at all costs is very helpful, and sticking to a heart healthy diet and avoiding sodium intake, especially excess sodium, is very helpful as well. In addition to the impact of sodium, we worry a lot about high carbohydrate intake, and that affects people. So we're looking more at protein-based diets lately, and keeping the sodium down, and preparing the food yourself makes it a lot better. Processed foods are to be avoided also at all costs. Mm-hmm.
And you raise a really good point about using diet as a primary modification. So people will come to me and say, well, if I get on this medication for high blood pressure, will I need to be on it forever? And that's the key. We can use medications to help us bring our blood pressure down while you're working on all the lifestyle modification. And ideally, you would bring it down yourself, and you can always get trialed off a medication.
Absolutely. Over the last couple of years, since we've really been pushing, especially moving towards plant-based diet, and obviously a vegan diet is the best, but it's very difficult for a lot of Americans to get there. But as close as you can get to that type of diet, you do better. But people who've adopted a healthier lifestyle and a healthier diet routinely, have success. I've had multiple patients who've lost, between 50 and 80 pounds, not through surgical intervention, but through diet intervention. And they come off of, all of their medications for blood pressure, for diabetes and other issues. And, we've really had a tremendous amount of success in that realm. And, that's continuing to be our focus. We have great medications, and we can do a great job of getting everybody's numbers, to be perfect with multiple drugs. But, I always feel the best when I can do it, working with the patient to get it, to get them there without the medications.
Sure. And I'll touch on one more lifestyle thing that people can do, and that's stress. Right now in the middle of a pandemic, people's stress levels are through the roof, and stress actually drives up your blood pressure quite a bit, as I'm sure many people who come into your office will tell you. So working on healthy ways to manage your stress, whether that's deep breathing or yoga or going for a walk, however you need to manage your stress in a natural way, that can go a long way.
That's a very important point. I think we see a lot of situations where the body is expressing what the mind is going through. And the point in this pandemic is that it creates a lot of sickness otherwise in people who are healthy, just because of the restrictions and the social isolation that we see. And it has an untoward effect on people's health as well. So it's important to counterbalance that by, getting social interaction, getting out there and exercising. That's going to help the body release substances that help you feel better and improve your mood. And that's going to make your overall state of health much better.
Agreed. So do you want to touch on some of the things that we talked about? Should we summarize?
I think, it's important to identify the problem. You should be able to check your blood pressure and then get to a health professional that can help you address what the numbers are, what they mean, what your risk is. Do any kind of other workup to make sure there's nothing going on that's causing the blood pressure to be elevated that's out of your control. And then to start working on all of these things that we talked about in terms of improving your health and your lifestyle and your diet in order to get you the best result with the fewest medications ultimately as possible.
That's great. All right. Well, it was good to see you here today, Dr. Toohey.
It was good to see you too.
Hope to see you.
Thank you so much.
Of course. Thank you. Have a good day.
You too.